right. Welcome back to Open Globe Talk. This is your host, Rizana Thani, and today this is an exciting duo episode with Dr. Tetyana Schneider, who's the Graduate Medical Education Program Administrator, who received her PhD in Education Leadership and Policy Analysis at UW-Madison, and Mrs. Hannah Baker, who's the Senior Graduate Medical Education Program Manager at University of Wisconsin-Madison, who received her education MA in Social Innovation and Sustainability, Leadership Education, and Leadership at Edgewood College. Her background is in international education and higher education, and both of them actually are part of the GO curriculum, which is a global ophthalmology curriculum at University of Wisconsin. I'm pretty sure that a lot of the listeners who are tuning in are interested in the University of Wisconsin. And for those who don't know about the curriculum, you'll find out today how unique their curriculum is in incorporating global education. So without further ado, I just want to welcome Tetyana and Hannah to the platform. And I want to start off with the most common question I ask my speakers of what led you both towards an interest in global health, and how did you become involved in the Dove's Go curriculum?
Great. Well, welcome. Well, thank you for welcoming us, Razul, and we're so excited to be here to have an opportunity to share a little bit more about our program and about us and kind of what we can offer and continue to develop, right, in the world of academic global higher ed. For us, both Tetyana and I, really our involvement is directly related to our positions within our department at UW-Madison, our responsibilities in and within education and ophthalmology. And both of us really are coming from prior background in global higher ed. And so because of that, I think in the development of our global curriculum, we really felt that approach, curricular format and design really was very approachable to us to kind of really look at the strategic direction of our department and where we're going with our global initiatives. And so that was a very familiar space, I think, for both of us. So yeah, great.
I will just add a couple of words to that like Hannah said, because of our prior experience in higher education and global education, with the emphasis on curriculum, when we started in our positions, we identified that as one of the needs, because until we have a formal curriculum, until we have a formal plan for all the experiences and making them intentional, it's not showing the actual commitment. And we felt that need had to be filled in, and that's where our efforts were put to bring everything that we were doing, because we were doing a lot of things. They were just not formalized. So, and building that global ophthalmology curriculum allowed us not only to share the message to our department, to the institution, but actually a lot through the outreach. So like, for example, that summit that Hannah and our Dr. Bradfield presented at was one of the opportunities to say, we are committed to this work.
And indeed, University of Wisconsin does prove that. So I noticed in the history of Doves, it started collaborating with global projects since the 1970s. So how have the partnerships changed over the decade? And what prompted the program to create the Global Ophthalmology Initiative, particularly in 2016?
Yeah, so I can kind of answer that. And I thought, it might just be nice for the listeners to learn have a little bit of that historical context. So thank you for this question, because I think that this is really the foundation of our programs have come from strong faculty champions, right? And so, historically, when we're looking at a lot of these global programs, we see these amazing engines, right, of human power and their connections. So, as you mentioned, since really the 1970s and prior to that too, but kind of more in a formalized way, we've really been contributing to advancing global ophthalmology in our department. And part of that was really, as I mentioned, through the leadership of two faculty champions. So one of those being Dr. Shresh Chandra. And so he he was a tenured faculty at UW-Madison, and in addition to his work in our department as a professor specializing in vitreoretinal disease, international ophthalmology, macular disease, ocular melanoma, and trauma, he also was, has been a huge pioneer, right, in developing a nonprofit called Combat Blindness International, which in the early days started as Combat Blindness Foundation. And so, and a huge goal of that nonprofit was really to establish connections in throughout India, as well as a variety of other locations now that they've expanded. And in addition to his work in Combat Blindness International, he also helped establish our labs, which is at Aravan Eye Hospital in Madurai, India. And so the goal of that lab was to really help produce quality, low cost intraocular lenses, and really just making surgery in general more accessible to the underserved within the regions and really throughout the world through access to these lenses. And so his pioneer and kind of leadership within our department and externally, right, has really helped found what in 2001 for us interdepartmentally was called the Division of International Ophthalmology. And so that really helped establish and engage our stakeholders, both locally and abroad, to really start formalizing some of these works and initiatives. And then in addition to that, we have had another faculty member, Dr. Guillermo Di Venetia, who is an ocular pathologist and medical retina specialist. And alongside his lifelong partner, Marta, they established in 1978 what was called the Free Real Eye Clinic, and we call that FREC for short. And that was established in Manila, Philippines. And the goal of that was really to bring sight restoring surgery to the Filipino rural community. So kind of looking at the over influx of need within that region and really bringing sight restoring care specifically to the eradication of cataract numbers within kind of these limited accessible regions within and around the area of Manila. And so through these kind of two really like amazing faculty champions, we have this foundation, right? And really growing that, and how can we foster and continue to develop that? And so so that's kind of where we came from, and kind of the amazing story that we share and hold very close to us. And in addition to that, we, as let's say a morphing or development from that, was in 2016, we kind of looked at, establishing what would be at our current time, the International Ophthalmology. So it transitioned from the Division of International Ophthalmology to International Ophthalmology. And then actually further on in 2019, we kind of renamed ourselves Global Ophthalmology. And that the intent of that really was to mirror more, to reflect the contextual language, right, around global health, to kind of develop more of a holistic approach to the way that we talk about these programs from a local to global sense, and really kind of hone in on those bilateral partnerships. And so that has all been in those recent years, since Dr. Chandra and Dr. Di Venetia have kind of passed that effort on, has been through the emphasis of our department chair, Dr. Terry Young, since her arrival in 2014, and then really the present day leadership and strategic direction of Dr. Yasmin Bradfield and Dr. Kat Percat, who are two co-chairs of the Global Ophthalmology Initiatives. So I know it's a lot of context around and history around our work, but that really has, I think, branded and I would say packaged our program, as Tetyana said, kind of putting it, we've been doing all these things for all these years, but really putting it into a consolidated scope of work for our department, and really trying to emphasize all of our centers of excellence, right, in clinical education and in research. So, yeah.
I wanted to ask, how did the certificates kind of come into play with this, with the start of this program? I think it's really cool that you give something, I guess, physical to the trainees so that they can carry forward after they leave the residency. And I'm also curious, how some of the trainees have come back to Madison and given back to its community, because not a lot of people are familiar with Madison, Wisconsin. I mean, Epic is there. Lots of really big names are there. It's one of those places that plays very low key, but is definitely not.
Thank you for this question. So first of all, we wanted to recognize the residents who have successfully completed the required work. And again, reminder that this is a 3-year curriculum, and it does not only include international and domestic field works, but it also comprised of reading, reflections, and participation in discussion sessions. So we wanted to make sure that the residents not only have done their work, but they are recognized for it. And global ophthalmology is still a developing area in the residency program nationwide. Like one of the examples that SCGME only indicates elective international experience in its common program requirements without providing much of a guidance. However, there is nothing indicated about global ophthalmology. However, the need for global ophthalmologists is growing, and like and your audience know, in some instances, it's even urgent. So we wanted to make sure that our residents or prospective candidates know that we have a serious commitment to the global ophthalmology by issuing a signed document verifying the completion of the formal curriculum. And finally, when our graduates go into the professional world, this certificate, they will work in various private and public institutions. So that particular certificate shows diverse patient, that they are prepared to serve diverse patient populations. And the skills they develop through our curriculum prepare them to adapt and be active citizens in any community they will go. And what we found that actually it does provide a long-term impact. So we continue engaging with our alumni. For example, we have 2 of them traveling with our residents to India and the Philippines next year. We also aim for their medical knowledge and self-development exploration through the global ophthalmology with our residents, even though they are already practicing professionals. And also another aspect that we want them to be engaged with our residents is advocacy. So it's very important for our curriculum outside even global ophthalmology, but it's a huge component of our teaching as well. So that allows them to, in addition to exploring their self-identity and being able to relate, they just know how to advocate for others. And this is the skill that our program finds very, very important.
I'm glad that you mentioned that, Tetyana, about just how important it is for trainees to be educated in serving diverse patient populations. I'm curious, are the residents necessarily coming from international backgrounds or had some international exposure prior to entering the residency? Or have you had trainees who have had none of those experiences, maybe just the domestic experiences, and how they've transformed over the years, just based on, primary experience with them? I'm kind of curious and kind of glad that you're leading an initiative where you're not just exposing them to international sites, but also educating them.
We are cognizant that we will have trainees with different diverse background. And when we were thinking about developing the global curriculum, global ophthalmology curriculum, we had thinking in mind that we need to meet the residents where they are. And some will have extensive international experience or global experience, and some will not have. So that's why a lot of our activities meet different needs. And right now, another piece that is critically important to share with the audience is that we are actually doing the research behind the scenes. So we are assessing the growth of residents from one year to another year. So when they graduate, they can actually see how the development was going. And again, in education, we always know the trajectory might not be immediately very steady and immediately going up, but that's a part of the growth. And we are very happy to report that we have collected the data over the last several years, and we continue doing that. So we'll probably publish it at some point so that we could show to other institutions who are interested, but mainly to our residents, that this is important. And even if they come from diverse, non-diverse backgrounds, the patients will need those skills. So, and we are ready to prepare them for that diverse world.
And oh, sorry, Hannah, go ahead.
No, it's okay. I just want to add that I think one big part of the way that we've comprised or designed this curriculum is really from a growth perspective, right? And so the way that our residents are moving through our modules and in the knowledge and the skill development is really intentional, and it's really meant to build on from each year of training. And so, for example, when residents are first starting to engage with our curriculum, one of our assignments is talking about just introducing yourself and your past experience. So we have this, kind of, as Tetyana mentioned, is like meeting them where they're at. Where are you approaching and coming into this work, and how can we best support your growth and learning, as well as you recognizing where you can kind of build and grow on. And so those conversations are continued to build upon every time we have our global ophthalmology basic science lecture, where we're talking about our own identities and how they relate to this work. And it's been really quite fascinating to engage with the residents and have these very thoughtful, intentional discussions where we are, right in front of us, right? Having the opportunity to really deeply, and I think very authentically, kind of grapple with, well, this week I'm feeling, or this year maybe in training, I'm feeling further on in my progress. And some are saying, oh, wow, I'm actually feeling like I'm retracting in this way. And I want to continue to, grow in this new avenue and direction. So anyway, I just wanted to elaborate that is a huge part of the climate and culture around these discussions, and really where we feel the intentionality of our work, and the way that we want to create conversation around this growth learning opportunity is what is offered through this course. So
one thing I wanted to kind of ask you both is, how are you measuring these metrics to evaluate how these residents are growing? Is it some form of survey that your staff has created, specifically based on your experiences of what metrics you're looking for?
Tetyana, do you want to take it, or I either way?
Yeah, probably Hannah will add, but so one of the pieces that we wanted, and that is going back to the certificate, we've been grasping with what does growth mean? And with global ophthalmology, or with even global citizenship, it's very difficult to measure to what extent you are a global citizen and to what extent you are a global ophthalmologist. So then, instead of numeric indicators or measurements, we actually came up with the qualitative measurements. And we have a scale that shows to our residents, instead of 1 to 5, we have the qualitative measurements that will actually tell them a story about themselves and the trajectory of their growth. So whether they are novice in something, or they actually go into the advocacy level. So we have created it ourselves. And like I said, that we've piloted it, and we continue getting the data and collecting the data so that we could publish it. But we could not find a tool or measurement that we could use. So we created our own. And I will let Hannah add to that.
And a part of that assessment, Rizul, and for our listeners, is really trying to, because it's coming from that qualitative perspective, as Tetyana mentioned, it's really so that we're touching base on a modular kind of, there's 3 modules as a part of this curriculum. And so that each year that the resident is, or the learner is engaging, that they're kind of having this touch base with, well, where was I pulsing this year? So that throughout their kind of the frequency of how often they're being assessed, it is really kind of at the end cap of that incremental point, right? As I was mentioning earlier, so that they can also see, as I'm growing and engaging in these different opportunities, that they can really measure that change. And say, oh, you know, right now I'm really feeling that I'm in kind of this early learning development stage of global ophthalmology, or wow, I've really moved into this other level where I'm feeling in a stronger sense of advocacy, and I'm feeling more independent in my development within global ophthalmology. So that's just to add a few notes there.
Yeah, I'm actually pretty interested in that metric, like what metrics you use. And I gathered qualitative research is going to come very useful in these experiences, just because everybody's coming in with different expectations for how they're going to utilize global ophthalmology in their career. And that is really smart of you guys to have like come up with that qualitative design as opposed to a quantitative, which can be biased by, you know, what the researchers think is important. So
And
yeah.
if you don't mind me adding one more thing about the assessment too, is that I also will say one thing that we have built into this curriculum that's very intentional is looking at the core competencies within ACGME and saying, okay, where are we at when it comes to interpersonal communication, right? And so we're looking at and really identifying some of those core elements that are a part of the resident training curriculum expectation, and also trying to really craft that as a part of the intentionality within that assessment as well. So just to also share that that has been a factor in the creation of our qualitative assessment, so that we are really able to kind of draw some correlations, right? Even though it's qualitative, to those core competencies and those milestones, so that we can really, everyone can speak on the same level, right? That like, oh, this is approachable within this learning as well. So that's another thing to add.
Yeah, this is really exciting because, you know, I think a lot of programs often have issues with incorporating global ophthalmology in their curriculum. The explanation is that, well, we can't give credit to the residents. This doesn't count towards ACGME. So for our listeners and for anybody who's, you know, program director or somebody who's organizing their programs trying to do something similar, how have you established things at UW for giving incentive to programs for incorporating global ophthalmology?
On our department level or program level, our department in general is very, very committed to education and innovation in education. So if our faculty have some innovative ideas, we support them with providing some additional funding for that. In addition, when they develop a curriculum, and again, I just want to be very clear that it's still a process. They cannot just develop a curriculum that has to go through the pilot, then they present to the group, and until it is approved, then they cannot offer it on an annual basis. But what we are trying to emphasize is that it's not extra, it's a part of. And Hannah, for example, can speak to one of the innovative ideas that actually one of the faculty who is our alum brought back to us and said, you know, when I traveled to India, this particular experience would have been helpful. And we're like, that is great. Can you tell us more? Can you develop something? And she developed a curriculum. And because she was already doing it, so it was not an extra work. It was just became a part of the global ophthalmology curriculum. And we added assessment. It's all supported with the data. So I think the important piece is that thinking through the lens of we are clinicians, but we are also educators. And we're educators, but we can think in the clinical world and how to combine those experiences. And Hannah and I are great support for our faculty, so they can even come up to us and brainstorm some of the ideas. But we're very, very cognizant of how we cannot add extra work, but actually use the existing resources and talents to enhance the experiences for our residents.
And I can just like briefly elaborate. So for example, what Tetyana was mentioning is that we have this global fieldwork simulation wet lab, right? That we are preparing our residents prior to going on a rotation globally to learn ECCE and M6, so that they are prepared kind of from this early standpoint of being able to kind of have an entry point into that surgical skill development while on site. And we feel like that, again, is really looking at the bilateral partnership approach. How do we prepare our residents before we go abroad? Not only from a medical knowledge standpoint, kind of just a clinical and surgical observership standpoint, but also to give the context and the language around that learning, and some of the opportunity to really approach the cross-cultural communication elements of being abroad, so that we are truly creating a more, as I mentioned earlier in our talk, really a holistic understanding and support for those partners when we are engaging on site, as well as when we welcome them here to UW and engage in that way as well.
I actually wanted to thank you guys for investing so much, indulging in so much detail about the curriculum, because it's something that I never captured at other programs, just because I think UW's is one of those institutes that has such a unique curriculum, and you guys have a plan in place to give credit to these residents. So as program coordinators, what are still some challenges that persist, and how do you anticipate that these will be solved over the next couple of years?
Yeah, so I can kind of start, I think, just in general, right, regarding, I think there's a sense of volatility that exists with local, national, and international systems. And that includes government, healthcare, environmental systems, and really how this directly impacts the way that providers and education, how we have access to new interventions of patient care, resources, and really when we step into, can we engage in a collaboration? What are the needs assessment? How can we be the best supportive stakeholders to each other? So I think that that's just a natural part of really global systems, right? And how we're engaging. So I think that will always be in kind of on the forefront of how we carve and craft these programs and how they evolve. But I think so that's one thing. And then I think another thing that when I was thinking about this question and really grappling with is that we have to understand that these types of curriculums are not for every learner, right? Not everyone is going to be interested at the same level and have the same level of dedication and investment and really, frankly, the same level of passion, right, in this type of work. And so, how can we engage on a personal and professional development and understand that that's a part of the choice of this? But one thing that we feel is very important at UW-Madison is that we want to ensure that there is an equitable offering to all of our trainees, right? So that application of this work, the opportunity exists for them to really advance in that way. And so, and we feel that that's unique. Some other programs, there's a lot of different ways that global ophthalmology can look within these residency programs and training programs. And we just feel that that is something we bring unique to the table to any learner, is that we're offering it to all. So those are a few things. And then, yeah, Tetyana, do you have anything to add that you'd like to? I have one more, but I want to let you kind of chime in as well.
Good.
Okay, so and then I think also just having this tailored curriculum, I think is really, because we understand what another really big challenge is that we know that we're crafting this for really the US residency program. We understand that this hasn't even yet scratched the surface of what it could be offering to global residents or other residency programs within a different cultural context. And so I think that that's another real challenge that we, especially when being recently in a part of those conversations at the recent Global Ophthalmology Summit, we understand that there's need in other spaces and places for educational development. And so I think that is something where we need to first understand our own curricular goals and our outcomes, so that we can further develop this program and really identify what our gaps are, where can we improve, so that we can really create a platform that is accessible to residents across really abroad and here and abroad. So
That is pretty powerful that you mention how different contextual environments can serve to prepare trainees for different lessons, because Wisconsin is not the same as North Carolina versus Louisiana, versus New York. And it's really interesting. It would be really interesting to see how the lessons are imparted at the end of training for different residents, because right now I think it depends on the resident themselves and the program themselves for offering those opportunities, and just how people take those perspectives and lessons in. It just depends. It's not structured, and neither is, I guess, a structured program, right? Like the lessons you take away are not necessarily going to be the same between one trainee to the other. So that's really, really interesting. But at least a structured program teaches you to be equipped with basic concepts of serving underserved populations and health disparities that I think as clinicians we find that maybe we're not best prepared to really address. And these are the reasons why I think the program at UW exists, and I've been hearing so many wonderful things about this program overall, not only within Wisconsin, but like at other programs that are trying to adapt and incorporate similar structures in place. Last question that I have for both of you. Not a lot of candidates might be from Wisconsin, but are very interested in going there. And I find that North Carolina has some similarities, except the winters are quite different. So what are some things that you love to do as unique aspects to the state and to Madison itself?
Well, I originally came from Ukraine. So one of the things attracted me to, and why I stayed in Wisconsin, because of the 4 seasons. I just love that throughout the year, you can do everything outside. And like right now we have beautiful fall. So spending the time outside, just walking around, and the colors are just magnificent. So in addition to the environmental aspect to it, because we have lakes and forests and such, we also have wonderful variety of, for example, food. So, and food is really important in Wisconsin. So if you're a dairy person, cheese, and you should try cheese curds in Wisconsin. You cannot find them anywhere else. And if somebody says that you can, no. And the third thing that should definitely attract you to Madison is our Babcock ice cream. When I worked in my previous position with international education, we even had participants at one of the conference that joined because they wanted to come back and have some of our Babcock ice cream. So yes, food and environment are definitely some of the things, but people. And I really like that Madison is a very diverse place. We have a lot of things to do for any background that you come from, and it's a family place as well. So these are kind of my bucket list items.
And Hannah?
Yeah, Tetyana, wow, you just did such a great job outlining a few things, many of lovely elements of Madison. I think one thing I really enjoy also as a transplant, I'm originally from Iowa, moved here about 13 years ago. And although I'm a Midwestern gal at heart, I think the unique thing I love about Madison and Wisconsin in this area is just the overall engagement in the community. And there are so many activities, whether you're an individual person coming to Madison with a partner or with a family, 4 seasons of engagement. And one thing I really appreciate is that you can always go out, and there's always, I would say there's people always outside and engaging in all times of year. So the winter does not scare folks here. There's lots of engagement, really fun activities. We have another thing like the farmers market, and just some, I would say, weekend activities. And it's a very dog friendly place too. So if you've got a pup, that's another kind of near and dear thing to me and my family, is that we like to really go to this beautiful large dog park. It's like 24 acres, and have a human hike as well as a canine hike. And it's just a really beautiful place to be in all the seasons. So those are my 2 cents above all of the great things that Tetyana has already added as well.
Awesome. Sign me up. My dog Max is going to love places like that for sure. But both of you, thank you so much for your time. And I couldn't be more thankful for all the information you've imparted. I think that we've learned some really important lessons through this segment and taken away, just how one program is making a change that is rippling through the nation and at the international level. And I'm so glad that, these dire circumstances, unfortunately, but fortunately for us in these virtual environments, have connected us from one state to another and from one country to another. So thank you so much for your time and hope to see you guys again in the near future.